Every morning, your heart sends you a report. Not loudly, not dramatically. In the quiet of the first few minutes after you wake, before the noise begins, before the phone is checked, before the day makes its demands, your body speaks. Ancient healers knew this. They built their entire diagnostic practice around the morning hour. They called it the time of clear reading, the window when the body's signals were least distorted by food, movement, stress, or emotion. A skilled ancient healer could tell more about the state of a patient's heart in those first waking minutes than in any other time of day. Today, I am sharing 9 of those morning signals with you. 9 things your heart communicates every single morning. Some quietly, some urgently, that most people never learn to read. If you recognize several of these signals in yourself, please seek medical attention. A morning that feels wrong is a morning the body is asking to be heard. Before the 9 signals, let us understand what ancient healers understood about the morning and the heart that shaped this entire practice. In ancient Chinese medicine, the heart was called the emperor organ, the ruler of all other organs, the one whose health or sickness determined the health or sickness of everything else. And the morning, specifically the 2-hour window after waking, was called the heart's hour of self-report. Ancient Chinese physicians believed that during sleep, the heart had processed the previous day and was now communicating the result of that processing in the language of physical sensation, pulse quality, dream residue, and the immediate feeling of waking. In ancient Ayurvedic medicine, the morning pulse, taken before any food, movement, or speaking, was considered the most truthful pulse in the day. Ancient Ayurvedic physicians trained for years to read what they called the morning nadi, the pulse of the deep internal state, because they believed it reflected not just the heart, but the body's accumulated health or accumulated damage across months and years. Both traditions were describing something modern cardiology now confirms. The morning hours, specifically between waking and 2 hours after, are the highest risk window for cardiac events. Blood pressure is naturally elevated. Platelet aggregation is higher. The sympathetic nervous system shifts gear. If the heart has been under sustained stress, morning is when it speaks most clearly. Here are the 9 signals. Signal 1. The quality of your first breath. Ancient healers asked every patient the same first question at a morning consultation. How did you breathe when you first woke? A heart working efficiently allows the lungs to fill completely on the first breath of the day. The breath is easy, deep, and unrestricted. A heart under stress, specifically a heart struggling with fluid retention or reduced pumping efficiency, creates a subtle resistance in that first breath. The lungs cannot quite fill completely. The breath feels shallow, slightly effortful, or is accompanied by a quiet urge to clear the throat. Ancient Chinese physicians called this the lung reporting to the emperor, because in the five-element system, the lungs are the heart's closest partner. When the emperor struggles, the lung speaks first. Pay attention to your first breath tomorrow morning. Is it full and easy? Or is there resistance, restriction, or a need to breathe more carefully than usual? Signal 2. The feeling in your chest on waking. Not pain, not pressure. The subtle feeling. A healthy heart waking from rest produces a clean, neutral sensation in the chest, or no sensation at all. Most people with healthy hearts never notice their chest in the morning because there is nothing to notice. A heart under stress produces what ancient healers described as heaviness, tightness, a held quality, a sense that the chest is not quite open. Modern cardiology calls this a precordial sensation, a feeling in the chest region that is below the threshold of pain, but above the threshold of normal comfort.
Ancient Ayurvedic healers classified this as Hridaya Bhara, heaviness of the heart center. They prescribed specific breathing practices to assess whether the heaviness cleared with movement and breath, or persisted regardless of what the patient did. Heaviness that cleared quickly was considered a sign of temporary tension. Heaviness that persisted unchanged for more than 30 minutes after waking was considered a signal requiring immediate investigation. Signal 3. Morning heart rate and rhythm. This is the most measurable of all 9 signals, and the one ancient pulse readers spent years training to assess. A healthy resting morning heart rate for most adults falls between 50 and 70 beats per minute. Ancient Chinese pulse readers did not count beats per minute. They assessed what they called the quality of the pulse river. Was it flowing smoothly and evenly? Was it choppy or irregular? Was it too shallow to feel or surprisingly forceful? An irregular morning pulse, one that skips, stutters, or races, was called a disturbed emperor in ancient Chinese medicine. It was considered one of the most significant diagnostic findings a physician could make, requiring immediate and sustained attention. You do not need ancient training to check this signal. Place 2 fingers on the inside of your wrist below the thumb. Count beats for 60 seconds. Then ask yourself, was every beat even and regular? Or did any beat feel early, late, or different from the others? Any consistent irregularity in the morning pulse deserves medical investigation. Signal 4. Morning swelling in the ankles and feet. This is a signal that most people notice and immediately dismiss. attributing it to a long day on their feet, salt the night before, or simply getting older. Morning ankle swelling is different from evening ankle swelling in one critical way. Evening swelling is almost always positional. Fluid accumulates in the legs during a day of standing or sitting. It resolves overnight when the legs are elevated during sleep. If you wake in the morning and your ankles are already swollen, the fluid is not resolving overnight. That is the sign. A heart that is not pumping efficiently cannot clear the fluid that accumulates in the lower extremities during sleep. Morning pitting edema, swelling that leaves a dent when pressed, is one of the clinical hallmarks of congestive heart failure. Ancient Ayurvedic healers called this shotha in the morning, distinct from shotha in the evening, and treated it as a serious diagnostic sign. They distinguished it from evening swelling by the specific instruction to examine the patient before any movement or standing. Morning swelling before the patient had taken a single step was the sign that concerned them. Signal 5. The quality of your sleep and the feeling on waking. Ancient healers did not ask patients whether they slept. They asked how they woke. A heart working well through the night produces a morning in which the patient feels genuinely restored. Not necessarily energetic, but restored. The body feels rested, the mind is clear. There is a natural readiness to begin the day. A heart under stress produces a specific morning experience that ancient healers recognized immediately. The patient wakes feeling as if they have not slept. The body feels heavy and unrefreshed despite hours in bed. There may be a memory of disturbed or vivid dreams, particularly dreams involving water, flooding, or a sense of being unable to breathe. Ancient Chinese medicine specifically documented these water dreams as a signal of heart-kidney imbalance, describing exactly the fluid retention dynamic that compromised cardiac function creates. Consistently waking unrefreshed, not occasionally but as a pattern, is a signal the heart is working harder than it should be during the night. Signal 6. Morning cough or need to clear the throat. This signal is so commonly attributed to other causes, post-nasal drip, acid reflux, seasonal allergies, that its cardiac origin is almost universally missed. A heart that is not pumping efficiently allows fluid to back up into the lungs, a condition called pulmonary congestion. The lungs respond to this accumulated fluid by triggering a cough or the need to clear the throat. In the early stages, this occurs primarily in the morning, when the patient has been lying flat for hours and fluid has had time to settle into the lung bases.
Ancient Chinese physicians called this the lung weeping for the emperor, and documented morning cough specifically as a sign to watch for alongside other cardiac signals. They were correct that the cough was a pulmonary symptom with a cardiac cause. A dry, persistent morning cough, or the consistent need to clear the throat upon waking, particularly when combined with any other signal on this list, deserves cardiac evaluation. Signal 7. Morning fatigue, disproportionate to sleep duration. We have spoken about unrefreshing sleep. This signal is different. It is the fatigue that arrives before the day has begun. A heart working at reduced efficiency forces every cell in the body to function on less oxygen and less fuel. The result is a systemic fatigue that is present from the first moment of waking and does not respond to coffee, movement, or activity. It is not tiredness that improves as the day goes on. It is heaviness that stays. Ancient Ayurvedic healers called this prana deficiency, a depletion of the vital breath that the heart distributes throughout the body. They documented it as one of the earliest signs of what they called Hridaya Darbalya, cardiac weakness, appearing months or years before any acute cardiac event. Morning fatigue that has been present consistently for weeks or months, that does not resolve with rest and is not explained by any other condition, is the heart asking to be examined. Signal 8. Morning dizziness or lightheadedness on standing. The moment of standing from a lying or seated position is one of the most demanding moments for the heart in the entire day. Blood pressure must adjust instantly to ensure the brain receives adequate blood flow despite the sudden change in position. A heart with strong pumping function makes this adjustment seamlessly. The person stands and feels nothing. A heart under stress, or one affected by the blood pressure medications many cardiac patients take, may fail to make this adjustment quickly enough, producing a moment of dizziness, lightheadedness, or visual dimming that lasts for several seconds after standing. Ancient Chinese physicians called this rising dizziness and distinguished it carefully from dizziness caused by other conditions. They noted that cardiac rising dizziness was typically brief, occurred consistently on standing, and was often accompanied by a momentary dimming of the visual field, what patients describe as their vision going gray for a second. Occasional morning dizziness on standing is common and usually benign. Consistent morning dizziness, occurring most mornings for weeks, is a signal that warrants investigation. Signal 9. The emotional tone of waking. This is the signal ancient healers valued most, and the one modern medicine has been slowest to formally recognize. In ancient Chinese medicine, the heart was the home of the Shen, the spirit, the emotional intelligence, the sense of self that gives life its meaning. A heart in balance produced a morning in which the patient woke with a clear sense of well-being. Not happiness necessarily, but stability, a groundedness, a feeling of being intact. A heart under stress, whether from physical strain, chronic inflammation, or early disease, produced what ancient physicians called disturbed Shen. Waking with unexplained anxiety, waking with a sense of dread without identifiable cause, waking with a feeling of sadness that is present before any thought has formed. An emotional quality in the first moments of consciousness that does not belong to any circumstance or event. Modern cardiology has confirmed what ancient healers observed. Anxiety, depression, and emotional instability are not just consequences of cardiac disease. They are early indicators. The heart and the emotional brain are in constant bi-directional communication. When the heart is struggling, the emotional signal often arrives before the physical symptoms become measurable. Pay attention to how you feel in the first 30 seconds of waking, before thought, before memory, before the day arrives. That emotional tone is the heart's most honest report. 9 signals. Ancient healers read them every morning, in their patients and in themselves. Not because they were looking for disease, but because they understood that the body always speaks before the crisis arrives. You do not need a physician's training to listen. You need only the habit of pausing in those first quiet minutes of the morning and asking the body a single question. How are you today? If you recognize 3 or more of these signals consistently, please see a doctor. Not because you are certainly unwell, but because the heart speaks most clearly before it shouts. And catching what it is saying now, when the signals are subtle, is what the ancient healers always understood to be the highest form of medicine. Prevention, not cure. If this found you at the right moment, share it with one person whose mornings you want to protect. They may never have known the body speaks this clearly. Subscribe to Ancient Body Wisdom and come back every single week. There is so much more the healers knew, and we are only just beginning.